Gen Zers, what I love about this group of people is that they are far more courageous and gutsy than many of us would have been earlier in our careers. So instead, oftentimes this group is kind of thinking, if my contribution and my impact isn't valued, maybe this isn't the place for me. And I think that takes a lot of courage to get to that point, right? So many of us just kind of accepted it as this is the best we get. So you just got to keep chugging along every day. When we see numbers around nurses leaving, generally they're getting out of direct patient care practice and doing something else. Maybe, I guess it could be academia. A lot of times it is things like getting into startup world, becoming a salesperson for medical product, healthcare devices, things of that nature. So I think once you have a nursing education and nursing experience, we're kind of educated and created unlike any other profession in terms of how we think and problem solve. So having nurses that are, I don't know, engineers, architects, coders, developers, I think is a brilliant move as well.
For the audience, what's our age group for Gen Z? I'm seeing some conflicting information online right now. Do you have a little authoritative stamp for us here? I mean, they're clearly in their 20s, but there's kind of a range there.
Yeah, there is a range. I don't have any sense of guidance for you. I see different cohorts that are specified quite often. I know that I have raised two that seem to fit right smack dab into the general persona that we often hear described.
Yeah. So I'm looking here, if we just go off of Pew Research, Gen Z is age 7 to 22 as of 2019. So that's,
I think the
couple
general
years ago.
consensus is that it's after, if you're born after the year 2000. I know it gets a little
Okay.
gray. I'm born
Pretty
in
close to
95. I'm
2000.
technically a zillennial, I think they've called it, where it's right in the transition there. But I think it's generally after the year 2000.
Thank you.
So there you go.
Well, I was going to ask you, so what is one to do? But the answer is innovate. The answer is take a leap. It's take a risk. It's make a change. It's go for it. I asked you earlier, what would you tell the CNO? Is that what you would tell them? You got to jump into something?